morning. This is Marlena Buchanan, instructor here at Henderson Community College. Today we're going to complete the skill Peri-Operative Assessment and IV maintenance and discontinuation. First, you'll get your physician's orders, and I have those here for Mr. Mason. He's going to surgery for a open cholecystectomy. He's in PO at midnight. He's to have an IV of normal saline at 83 cc's an hour. And I am to get the permit and get him ready for surgery. I understand that an aide has already taken him to the room, and he does have his gown on, and an IV nurse has already came and placed an IV in his right forearm. So I need to gather my equipment. I'm going to need my pre-op checklist. I'll need my consent for operation filled out. So I'll go ahead and fill that out at the top. Open cholecystectomy. And the doctor performing the procedure is Dr. Toom. I'll fill that out, and I'll have that ready to go when I go in the room. And my patient is Richard Mason, and I have his MR number, and his birth date is 10/10/1960. Okay, I have my thermometer. I already have a blood pressure cuff in the room so I can get baseline vital signs, and I'll get his height and weight when I'm in the room. All right. Hello, Mr. Toom. I'm your student nurse today. My name is Marlena. Nice to meet you. I understand that you're going to surgery today. Do you know what kind of surgery you're scheduled to have? And he'll tell me open gallbladder surgery. Okay. Well, are you in any discomfort right now? No. That's great. Okay, I just need to check your IV site here, make sure that it's okay. Now, in this part of the assessment, you're assessing the IV. You're going to use a look, listen, and feel technique. You're going to look at the insertion site. His is here in his right ventral, and there is no redness, there is no edema, there is no drainage. The dressing is dry and intact. He does have an IV of normal saline per the order, infusing at 83 cc's an hour. And you're going to lightly palpate along the catheter line and above the tip. Is that uncomfortable at all, sir? No. It feels nice and soft to palpation, and he does not express any discomfort with it. Well, I need you to let me know if you do have any problems with it, if you see it puffing up, if it feels uncomfortable, starts to leak, let me know. I'll come assess the site. But it looks fine. I need to check your bracelets, sir. Could you state your name for me again and your birth date, and check your MR number here to make sure that they all match? And indeed they do. I'm going to get your temperature here. Okay, 98.8. Your blood pressure is 127/87. Your oxygen saturation is 98%, and your heart rate is 80. Very good. All right, we have the baseline data completed. I understand that the aide has already filled in for me your height, and she got your weight a while ago. Is that correct? Okay. So you're 6 foot, and you weigh 190 pounds. Your temperature, I'm going to record that. Your heart rate, and I assessed your respirations. And your blood pressure is 122/64. Very good. Now, what time did you actually eat last and drink something last? 9 o'clock last night? Okay. So you've had nothing by mouth since 2100 last night. Are you allergic to anything? No. Okay, so no known allergies. You do have your bracelet on. Okay, I need you to read this permit that the physician wants you to read, stating that you understand the procedure that you're about to have today, that he has discussed the benefits with you and the risk of the surgery, that when you sign this you are consenting also to the administration of anesthesia and to any other persons assisting the physician during the surgery, that you approve of that also. So do you understand that? You do? Okay. Then I just need you to sign right here. Okay. And then I'm going to witness your signature, sir. So then I would sign here, and I would date it, and I would time it. Okay. So we have the informed consent completed. Now I have some questions I need to ask you, sir, as part of the pre-op checklist. Do you have any problems with your speech or your hearing? No. Okay. They're coming in about 30 minutes to get you, so it's important that you empty your bladder. So I'll let you get up and go empty your bladder and take care of that. Do you have any loose or capped teeth? No. Dentures? No. I see a pair of glasses over there. Is there going to be anybody here that could take those home for you? Okay. Do you have any contacts at all? No. What about hearing aid or any prosthetic limbs or an implantable pacemaker? No. Do you have any jewelry on? I don't see any. No. No jewelry. Necklace or any type of spiritual item like a rosary? No. And is there anything that I need to know about your health history that would be important to know about? Any rashes anywhere on your skin or any kind of problems? No. Okay. I'm going to let you rest for a while. I'm going to go out and check the doctor's chart, and the doctor's orders again, and make sure your chart is ready with all your lab tests on it and your diagnostic results before you go to surgery. Are you in any pain right now? No. Okay. Thank you, sir. I will be back when the surgery transport aide is here to get you ready to take you downstairs. I also will be back before then to do teaching with you. Okay. So you go back out and make sure that on the chart you have a CBC, the EKG, the results of the ultrasound for the gallbladder, and the H&P is on the chart, which is your history and physical. So check that off. And I see that they have not done any patient teaching today with this gentleman, so I do need to go back in and fill out the rest of my pre-op checklist. Okay. I see that your wife has come. Nice to meet you, ma'am. Okay, so I'll just explain to both of you what is going on here during the surgery, where he'll be downstairs and where you need to go, and also what will occur in the post-op period. Okay. Do you understand, sir, that after you have the surgery, that will take you to a special unit called the Post-Anesthesia Care Unit? Some people call it the Recovery Unit, where you will gradually wake up. They'll make sure that they try to keep you as comfortable as possible, keep you warm, make sure that you are fully aware and alert and awake. Your vital signs, your blood pressure, heart rate is normal, temperature is normal, pain is under control, and after about 2 hours, when they see that you are stable, they will move you back here to the same day area so that we can finish the recovery period here. So do you understand what the post-anesthesia care unit is for? Yes. And ma'am, when the transport aide comes to take him down, we will escort you to the surgery waiting area outside the surgical suite, where you will register with the hostess and make sure that you let her know where you are, so that you are there when the physician comes out to talk to you about your husband's surgery. Okay. Now, there's some important things that I need to teach you. Since you're having an open gallbladder, that means you're going to have an abdominal incision, and that you may not be as mobile as somebody who'd have a surgery somewhere else. Also, because you will be flat on your back during surgery, secretions tend to kind of go to the lungs, your blood kind of slows down, and it may want to pool somewhere and cause problems. After surgery, you may not be as active the first day. And so I want to teach you some techniques to keep you from getting pneumonia or fluid in your lungs, and to keep you from getting any clots in your lower legs. So first we're going to do the coughing and deep breathing exercise. So what I want you to do is I want you to close your mouth and breathe in your nose a deep breath, and then blow it out slowly. And when you breathe it in, I want you to count to 5 in your mind. Okay? 1, 2, 3, 4, 5, and then I want you to blow it out. You also may have a device called an incentive spirometer that you can do deep breathing on also, that will help you. So let's do one together, okay? So close your mouth and just go deep breathe in your nose. Okay. Every hour we want you to do 10 of those. Now, after you do 9, on the 10th one, I want you to take a pillow. So let me get you a pillow here. You want to take your hands and hold it firmly against your belly, against the incision, to give it support so it doesn't hurt as bad when you actually do cough. Or if you have to move or something, you want to give support to that incisional wall. So what I want you to do is you're going to close your mouth, take a deep breath in your nose, hold it for more than 5 seconds, then when you're ready to breathe out, cough. And then that'll help clear secretions from the airway and open up your breathing sac. So here we go. Oh, very good. Okay. Now, there'll be someone to remind you to do this every hour times 10 breaths. Now, we're going to talk about your circulation, keeping that blood pumping so you don't get a clot anywhere. The first thing we're going to do is come in every 2 hours and remind you to change position. Turn from one side to the other or back on your back. We'll also get you up in the chair as soon as we can and get you walking also. That will help. So that's important. The other is leg and foot exercises. So what I want you to do is I want you to take your feet and push them down like pushing on a gas pedal, and then pull them back, and it's like ankle pumps, up and down, up and down. Very good. And you can move them around one way, around the other way. Very good. The other thing that you can do to help promote blood return to the heart is tighten up your quadricep here in your thigh. So tighten it and hold it tight for 5 seconds, release it. Tighten, release it. Do several of those every hour. Another one that is really good, and people don't think about it, is your bottom area. If you would tighten up your butt like a butt squeeze, tighten it really tight for 5 or 6 seconds, release. Tighten, release. That helps to pump blood back. You may come back from surgery with a device called a sequential compression device. You may or may not have a white pantyhose type knee-high stocking underneath it, or you may just have the leg wrap for the sequential device. And what that is, it is connected to a hose with a little pump at the end of your bed. It fills this sleeve with air and compresses up your leg to promote blood return to your heart, to prevent any pooling of blood and prevent a clot from forming. You may come back with that, and if that's the case, that's a good thing to prevent any problems. So do you understand what I have talked to you about with the deep breathing, with the splitting your abdomen with a pillow so you have support to the incision, your ankle and leg and buttock exercises, increasing your mobility after surgery, and the possible sequential compression devices. And you'll still have your IV also, and you'll need to keep an eye on that, let them know if there's any problems, and they'll check it also.